I used to take care of a patient who was unfortunately a frequent flyer in our operating room. She'd been through a lot over many, many years. And if anybody here has ever been a repeat patient, you know that it just gets harder and harder and harder every time you have to come back to the operating room. When I started taking care of this young girl, she was in elementary school. And by the time this particular story takes place, she was probably 12 or 13 years old. I had a great rapport with her and her family because I think they really saw that my heart broke for them and what they were going through. But bringing her back to the operating room was never easy. I was lucky to be in a place where we had some resources. So we would, put television shows up from YouTube for kids to watch while we were getting ready to put them under anesthesia, or play music for them, or things to kind of soothe them to make them feel a little less vulnerable in the operating room. But in this particular facility, we usually did not have parents coming back with us into the operating room. So as I went out to do my pre-op interview, like I always did, I asked her what she wanted to listen to in the operating room that particular day. And she decided that she wanted to listen to Miley Cyrus. Okay, we can make that happen. With YouTube, we could put absolutely anything on from any country, anywhere. So I went and I got everything set up in the operating room, ready to put on Miley Cyrus. And I went with anesthesia to bring this patient back. And the minute I rolled her back and she was starting to tense up, and everybody in the room felt it. And I clicked on, and Miley Cyrus started blasting in the operating room. Now, I'm not saying just a little bit of music, like we were blasting it to the point that everybody in the substerile core came and looked to try to see what we were doing. And even everybody in the room was a bit confused. But she moved from onto the operating room bed with no problem. Her and I were belting Miley Cyrus at the top of our lungs. And some of the people in the room kind of caught on, and they kind of joined in and started belting it too. But she was calm. She let us get her EKG stickers on. She let us get the pulse ox on. She let us take the blood pressure, all the normal routine stuff. She was fine holding the oxygen mask, belting Miley Cyrus. It's interesting because we always tell people, we have to kind of be quiet during induction. We don't want to be loud. We don't want to do anything distracting. Well, but for this kid, polar opposite. We were belting as she was getting the propofol pushed. And as the propofol was getting pushed, our surgeon, who was brilliant, but also a little more on the reserve side, came in and gave me the look of death. She had no idea what I was doing. But this young girl went to sleep without any difficulty. And the minute she was completely under and we were confident, we killed the Miley Cyrus because we couldn't take it anymore. I think what I learned from that day was, one, it's okay to do crazy things for your patients. And two, you've got to meet your patients where they are. This was a very unconventional day, like blasting music in an operating room. Who does that? But it kept her calm, it kept her working with us, and it kept her compliant with everything that we needed from her. And in the end, she was just a little less terrified and a little less freaked out of having to come back to the operating room one more time.